When it comes to multiple choice questions, there's these things called foils, brilliantly discussed by Billy Mallon in the free Invictus podcast, link below. And one of the classic foils, and a foil is something that is believable in the answers. So a disease which sort of is a little bit complicated but could answer the question. And so whenever you do a multiple choice questions, they'll often throw in a few foils which would, could actually be the right answer. And so you need to know what those foil diseases are, and you need to know them in some detail so you can exclude them. So the first one I want to talk about is Guillain-Barre Syndrome. Guillain-Barre Syndrome is an ascending paralysis, classically starts at the toes, works its way up your body, and it's a problem because if it gets to your diaphragm and your chest muscles, you can stop breathing, and that would be considered bad. It is a post-infectious disease, considered an autoimmune disease. The classic thing is Campylobacter, but it can be from a variety of viruses, and it is classically pure motor, although almost everybody complains of some sensory symptoms. So it's ascending paralysis from the toes up, sometime after a GI or an upper respiratory tract infection, weeks to months later. And there's also these sort of classic variants, and the classic one to know about is the Miller-Fisher variant, which involves the bulbar muscles. So you have difficulty swallowing, difficulty phonating, your eyeballs don't work correctly because it's affecting the highly innervated bulbar muscles. We'll talk more about Guillain-Barre syndrome, but start to get to know this thing really well because you'll find it as an answer in lots of neurological questions, and it might be a foil in many of those questions, so you need to know what it is. Ascending paralysis, toes up, without sensory findings, post-infectious complication. Herb it out.